Industrialized healthcare, like Ford industrialized the manufacturing of cars, the same thing has happened to medicine. It doesn't make sense, right? Because you're one human body. The one thing I think that will change dramatically how we can improve people's health is exosome therapy.
Dr. E is a pioneer in the future of medicine. A London-trained general practitioner, TEDx speaker, and visionary in healthcare, he isn't just treating illness, he's re-engineering health itself. He runs a leading longevity clinic, creating a movement where health isn't just about avoiding disease. It's about optimizing human potential. Today, he reveals the early warning signs we should all look out for.
The human wear deteriorates over time. The sooner we can identify the deterioration, the quicker we can prevent that deterioration. I was really surprised that we could improve people's health and their requirement for medication would decrease. It's my newest treatment. I've had it in the clinic for about 6 to 9 months now. I love it. It's one treatment that increases your Vo2 Max. That's a decade of decline we're reversing in 2 weeks. When things are not done to a good standard, actually everyone loses in this. You lose its potential. What it could be is the future of healthcare, making healthcare better.
Hi, Dr. E. Welcome to our podcast today. I would love to know what drives you.
A pursuit of betterness. Yeah, I think it's just a pursuit to want to make the world a little bit better through the people that I touch, through the skills I've acquired and the experiences that I've acquired. Innovation has been interesting to me. It's like how do we make things better? And in medicine, it's quite hard to innovate because ideas need to be sound, they need to be clinically proven, they need to be safe. You're advocating to your patients on these new ways of thinking, these new ways of approaching their health, and it requires confidence and competence in understanding the human body and whether that innovation or that new thing is the right thing for them at the right time. So I think what drives me is wanting to get better outcomes with patients, improve their quality of life.
I hear about your speech before when you talk about the downside of the modern medical system. What will be that innovation idea that could potentially changing our trajectory for the future?
I think one of the real challenges with modern medicine, the way it's set up, the way we adopt and take ideas from science and put them into practice, is that it takes a very long time for us to take something that is based off strong science, that is shown to have some positive outcomes, and then by the time it gets into the healthcare system, it may be 10, 15 years before patients can actually receive it. That gap is getting bigger and bigger. How do we overcome that is not an uncomplicated unraveling that we need to do. But I think if we go back to how we define disease, I think that's a good starting point. I find that a lot of the innovations are based around the classification, the pre-existing classification of disease. The question is, has this classification been updated? Has it been modernized over the last 10, 15 years? And more often than not, it hasn't been. We're using very similar diagnostic criteria and we're going after those same problems. And we're waiting until something fits into that diagnosis box before we try to find solutions and innovate. So I think one of the biggest innovations we could do is to start to make that diagnosis box bigger. To say, actually, the earlier symptoms, energy going down, becoming irritable, a little bit of anxiety, poor sleep, bloating, the earlier signs and symptoms that don't quite fit into the diagnosis codes, I feel like that's where we should be putting more attention. Because the human wear, I'll use your phrase, is beautiful. The human wear deteriorates over time. The sooner we can identify the deterioration and the reason why it's deteriorating, the quicker we can prevent that deterioration. In the outcome being improved health and also pushing disease further away.
I really agree with you because when you put those sickness into words, but that's already really later stage. But if we can identify some of those disease that we could potentially prevent it before that stage. And according to you, what is aging? Can aging be reversed?
Yeah, really good question. Aging is a process. And I think we start by understanding that the human body and biology is pre-programmed to deteriorate. We start as an embryo and we grow into an adult, and then we decline into old age and we deteriorate. That's a pre-programming that we're all susceptible to. We need to understand the pre-programming on the way up and the pre-programming on the way down, and what processes slow down, what processes become inefficient, and how does that manifest into disease ultimately. And that's all known as the hallmarks of aging. So there's a lot of longevity science that has been, really finding its feet over the last 20 years. And they've categorized that into different kind of key characteristics of aging: the quality of stem cell production, the efficiency of stem cell reproduction, the efficiency of aging cell death, senescent cell death. The same thing is being applied to the mitochondria, mitochondrial biogenesis, mitochondrial autophagy, or also known as mitophagy. How efficiently any DNA that is misfolded in its creation, we have processes that cleans that up, etc., etc. So all of these hallmarks of aging are characteristics we can start to apply diagnostic or biomarker assessments to. We can identify for each person what their propensity and how their propensity to age is. Once we identify your particular propensity of aging, because we all age same but different, we're susceptible to our environment over time. It accumulates and it affects our biology. So then once we've got that blueprint for each person, we can start to create strategies and personalized strategies and seek to prevent decline or reverse some of that decline by utilizing certain therapies that work on those hallmarks of aging.
When you look into the market nowadays, there are so many different tests. There has a test you can do at home. There has the test you can do with your GP. But according to you, if I'm an average stranger on the street, what will be the process for me to find that blueprint for myself? Do I go for my GP? Do I go for a certain center to do those tests?
Yeah, really, really good. I'm trying to think of a good analogy for you. You're not going to get Michelin star food in a McDonald's, right?
Yeah.
You know what McDonald's is for. It's going to give you fast food. Okay? And if you want a Michelin star restaurant, you have to go find a Michelin star restaurant. And that's going to give you a different experience with your food. The same thing applies to your human body. And I'm not trying to compare traditional medicine with McDonald's in any way. I'm not comparing that. What I'm saying is that traditional medicine will help you identify disease. It's not going to help you slow down aging. It's not going to help you reverse aging. So the tools that they have, the type of fry pans they use, the type of oil they use, the type, etc., it will produce identification of disease and then management of disease. The traditional healthcare is very good at that. That's where all the innovation happens.
Yeah.
Once you're beyond 50, 55, on average, 1 in 2 people get a chronic disease for life at the age of 48 in the Western world. Me or you, by the age of 48 to 50, will have a lifelong chronic disease, their first one. Then that turns into a second one. Then that turns into a third one. This is how people end up on 20 medications by the time they're 70, 75, all with different types of side effects affecting their different organs and tissues. The starting point is understand what you're looking for. If you're looking for disease management, then engage with the traditional health system. If you're not looking for traditional healthcare approach, then you have to go to places or people or experts or teams that will be looking to solve that problem with you. Because there's two things here. It's not just the data points, it's the expertise and their experience in analyzing and interpreting, putting into context those data points. What's clinically relevant from these data points, and what's the strategy we're going to deploy to make sure that we get the outcome in the quickest way possible, which is an improvement in your health in the short, medium, and long term. That's what longevity should be. Longevity medicine is how do we improve your health in the short term, in the medium term, and the long term. And it should be able to be applied to anyone at any stage of life. So you should be able to apply those longevity medicine principles to someone that is in a complicated health state, in a disease state, or someone at the other end who's looking for elite performance before they've become sick. The principles of longevity medicine, if done correctly, is really just deeper forensic biological engineering.
I believe everything in life is a trade-off. If you put a little bit time today to take care of your health, to do the health care rather than the sick care, you are very likely to ending up in a longer life with less time in the hospital in the future. One thing is really funny is when we look at our parents' generation, I realize my parents and my friends' parents, they look like a different age. So I think all those good habits compounding throughout our lifetime. But I think the difficulty for nowadays, we start to be more aware on this preventative healthcare. And we start to know, okay, we need to do more towards our health. We all heard about this thing about functional medicine and all of that. According to you, what is functional medicine?
Industrialized healthcare, like Ford industrialized the manufacturing of cars, the engine made in one country, you have the lights made in a different factory, and the exhaust made in a different factory, and it comes to an assembly line. The same thing has happened to medicine. We have a heart doctor, but you can't speak to the heart doctor about your stomach problem, and you can't speak to your stomach doctor about your breathing issue. We've super specialized where you have different specialists of different organs. And the general practitioner now, or the general physician, especially in the UK, although it's a specialty training program, is excellent at managing the early symptoms of those organs, but anything a bit more complicated, he or she will be helping you navigate going to all of these different specialist appointments. It doesn't make sense, right? Because you're one human body.
Yes.
And the lungs are connected to the heart, and the heart is connected to the stomach, and the stomach is connected to the liver. And the function of these organs are connected. And this is what functional medicine is. It's a medicine of understanding how the systems are working within the body and how the different systems are connecting and connected. What's really nice about functional medicine is that it helps to start to explain different health disease states, that when you start to apply that theory, it will either work or it won't work. Okay? And usually it works. So for the first time, we start to have explanations for why people get autoimmune conditions and what we can do about it apart from giving biological steroids or disease-modifying anti-rheumatic drugs, DMARDs, to just control the inflammation. We're looking for the root cause of why you're getting that inflammation. What is it from your environment? What is it in your systems that predisposes you to become inflamed? For a long time, we couldn't, when we trained in medicine, we're not explaining or getting to the root cause of these autoimmune conditions. So that was very powerful for me. When I first studied functional medicine at the Institute of Functional Medicine more than 10 years ago, and I started applying this type of medicine and this methodology to patients that had autoimmunity, I was really surprised that we could improve people's health, we could decrease their inflammation, and you would see that in your biomarkers, and their requirement for medication would decrease. Their length of remission, how long they would stay out of a flare, would increase. And so functional medicine is very powerful at understanding how you got there in the first place. How did your health end up in this place right now? And unravels the past.
Yeah.
Okay. What longevity medicine is very good at, it looks at the future. Okay. And it says, okay, what information do we need to get to predict, to understand Méline's predispositions for developing those chronic diseases, which 90% of us get. This type of medicine that we practice is a very nice combination of the past and the future. And combining those two to engineer your state of health now and then improve it for the future as well. Then I would say there's 5 main pillars of functional medicine. One is a really good understanding of how your digestive system works. The human body, the way it operates is that it takes from our nutrition, it breaks it down into vitamins, so macronutrients, so carbs, proteins, fats, and micronutrients. Micronutrients being vitamins, minerals, amino acids. And from the DNA within each of our cells, those micronutrients then goes into our blood supply to our cells and gets delivered to our cells. And the DNA in each of our cells, in the nucleus, is the coding. I call it the software.
Yeah.
Is the coding of the cell that tells the cell, okay, you need to take these amino acids and you need to make these proteins, hormones, enzymes. And it does that. It will build from those building blocks that should come from our food through an efficient digestive tract, delivered through a good vascular. It will start to make these protein, hormones, and enzymes that get used for different biochemical processes. The other important nutrient that we need to deliver is oxygen to all of our cells, because oxygen is energy, ultimately, is the precursor to energy. Without oxygen, our cells can't survive. And so that's why we have a heart and a lung and lungs, a cardiorespiratory system. We have the pump and the airbag that expands. The whole purpose of that is to take in oxygen and breathe out carbon dioxide and deliver that to our cells. That, at a very basic level, is what we want to make sure that we're optimizing. Now, the process of digestion is a 3-stage process. You get digestion, stomach and esophagus and saliva producing digestive enzymes, small intestine absorbing. Once you've broken down the food into a liquid, it goes into the small intestine, kilometers of surface area of the small intestine. The whole purpose of it is to absorb from the digested food, the liquid now, the micronutrients, and send them through the plumbing and the pump into, all your blood vessels to your tissues and cells. Then you have excretion in your large intestine to excrete all of the waste products that we don't need. In functional medicine, we start with the whole digestive tract, how you digest, absorb and excrete, and whether you do that efficiently and effectively, and whether there's any problems with that, because we can get problems with that process a lot of the time. This is even before we start to look at what type of food you're eating. What's your microbiome like? Do you have any parasites? Do you have any viruses coming from your intestinal tract? What's your digestive enzyme production like? Are you producing enough hydrochloric acid? So that's first pillar, very important pillar.
I believe the gut health right now is a lot of people's issue. And sometimes even you just eat some food, you feel uncomfortable. So if I experience sometimes the uncomfort in my gut or in my stomach, what should I do?
Firstly, there's 2 types of discomfort that comes to mind. One would be, are you producing acid? Is it reflux? Or the second one is, you normally get discomfort if it's bloating. So if there's bloating, then you're producing gas to that food. And that's what's causing the bloating, right? The distension. The question is the internal environment within your digestive tract predisposing you to fermenting too much? Do you have an overgrowth of bad bugs? Typically, that's one of the drivers. Or are you driving an inflammatory response to that food? Okay.
So that would be allergies.
It would be sensitivities. Food sensitivities. Okay. There's the 4 types of immune response. So one of them is allergy. Allergy is immediate. The second type of immune reaction is something is mediated by the IgG antibodies, so the immunoglobulin G antibodies, and that's known as a delayed hypersensitivity reaction. It can go very unnoticed, but it can cause bloating, brain fog, indirectly drive inflammatory responses. And that is normally associated with a condition of the gut called leaky gut. The small intestine junctions become open, and it's very common actually. And in our baseline bloods we do at Human, we test for that from the beginning as part of our baseline panel of tests, because we see it so commonly. And more often than not, that's one of the drivers. So it could be dysbiosis, which means imbalance of the bugs within your stomach or intestine. It could be not enough or too much hydrochloric acid production from your stomach and saliva, or it could be leaky gut. Those normally are the underlying causes, which could be manifesting in food sensitivity. Because if your gut is leaky, then the food will trigger an immune response. So every time you get exposed to that same food, you mount a bit of a response. This is why we're seeing an increasing rise in dairy sensitivity and gluten sensitivity, partly because of the way we're making dairy and processing dairy and processing gluten, but it's also partly due to overexposure. We get it a lot from our diet, cow's milk, cakes, etc. We've had a lot of exposure to it. And then the important root cause of that, which we haven't discussed, is the soil. The soil that has been sprayed with chemicals, pesticides, herbicides. It's hard to avoid it. So the soil has got all these chemicals. It grows these nutrient-poor foods. The nutrient-poor foods we eat that have also got chemicals in it as well, especially if we're adding preservatives to our fruits and our foods, or they've been processed. We then put them in our body, and then we drive an immune response. It causes dysbiosis. And so treating it is pretty straightforward usually. Once you identify what's going on, it's easy to treat.
For example, if I feel constant, always discomfort in my stomach, I should first get myself tested. And then what will be the prescription, let's say, if I have leaky gut?
So if you have leaky gut, we'd be looking for, we have a gut barrier panel test that we do. It looks for 4 markers: zonulin and occludin, which are proteins that can get broken down, and they're known as tight junctions that hold your cells together in the small intestine. Chemical exposure, as I've just told you, can cause leaky gut, and then we measure that in your blood to see how much of those proteins, of those tight junctions in your blood. If there's too many of them, it's suggestive that you've got leaky gut. The third marker we look at is candida, yeast. We're seeing very commonly that people are having candida overgrowth in their blood. Candida causes carb cravings, so it could be the reason why some people crave carbs. Antibiotic overuse over time. When we're using antibiotics, very commonly doctors are dispensing antibiotics very freely over this last 20, 30 years, then we find that it creates the internal environment for yeast to grow. So we're seeing a lot of yeast overgrowth. And then finally, we also test for something called lipopolysaccharides, which are endotoxin produced by bad bacteria, gram-negative bacteria. So that's where the microbiome dysfunction comes in, bacterial microbiome dysfunction comes in. We get a sign of that.
So you mean if I'm craving for carbs, it could just be I have so much candida in my gut?
Absolutely, yeah.
One thing I come to realization is if some days you just feel bad, you feel depressed, or it could just be because of your physiology, it might have nothing to do with what you're thinking about. It just, you need to take care of your health and your body, even your gut, right? And sometimes we just blaming ourselves too harshly on we're probably thinking too much or something like that.
I think you're absolutely right on that. We're the explainers. As doctors, we should be looking to understand and explain things.
Yeah.
From a physiological, biological, biochemical perspective. Anxiety, low mood, irritability, very common symptoms that people experience. Typically, we have to look at our underlying condition, because our underlying condition will dictate the likelihood of experiencing those symptoms. When we haven't slept, when we're under a lot of stress, when we're not been eating well, these are the conditions that predispose us to getting anxious, to getting irritable, to losing our temper, to not feeling ourselves, to not making the best decisions. These are actually early warning signs that you should respond to. Okay? And look to improve your overall biological state, how efficiently you're taking nutrients and delivering them so that your cells can make serotonin that you can so your cells can produce energy to provide you the reserve that you need to deal with your day-to-day. We definitely see that a lot when people are more depleted, their mood is directly affected. And the depletion comes from nutrients, not giving the quality nutrients to our cells, and then also not providing the environment to regenerate and heal. That does lead me on to the second pillar.
Yes.
So we talked, in depth about the digestive tract. The second pillar we touched upon, immune system and inflammation. So inflammation is an over-exaggerated immune response. So what are the conditions to look at to create a healthy immune response? Yes, there's nutrients. Yes, very important that we get into good sleep practice, because it's in our deep sleep is when our immune system is most restorative. It's when our thymus produces T cells. It's when our bone marrow produces stem cells. It's when we produce the most natural killer cells that fight against cancerous changes. Looking at where you're currently at in this immune versus inflammation response is very important, and then helping to create the right strategy to overcome that. So digestive tract, inflammation. The next one is hormonal balance. Okay, so your hormones are your thermostats that help control your mood, energy, libido. The main key hormonal systems that we want to look at is your adrenal hormones, so stress responding hormones, your thyroid, which is your energy currency producing hormones, and your sex hormones. And they're all controlled within the brain by the pituitary gland.
Actually, about hormonal therapy, I would love to understand what was it and who will need it.
So there's different types of hormonal therapy. Hormone therapy is essentially giving you hormones that you might need if your hormones are depleted. Specific end hormones. You don't need to always give the hormones. You can work before the hormones by providing the environment internally. You can work on, from a micronutrient perspective, to support the adrenal glands before you give them hormones. Okay? So in these thermostats, they're actually very connected. So if one goes off, the other starts to compensate. We produce hormones as a response to our environment as well. So the adrenals, if we're keeping them alive and awake through stimuli and stress, this is how we engage with our environment, then they're going to get depleted. When they start to get depleted, you're going to put yourself in a biologically stressed state, which might mean that you feel a bit wired but tired. That's very common, feeling wired but tired. That's a predisposition to feeling anxious, and then irritable, etc. But eventually that depletes, then your thyroid gland often goes off, and then your sex hormones go off as well. This is where looking at hormonal balance is very, very important as the third pillar. Fourth pillar is looking at your micronutrients and metabolism, stuff that can sometimes get overlooked: your iron stores, your vitamin D, your B12, your folate, your magnesium, some very essential core micronutrients. Your metabolism is looking at how well you take sugar or fat and make energy. Now, how is that representing in your lipid profile? Science has moved on. There's more specific markers that you can use. Just because the doctors in traditional medicine aren't using them yet, it's only because they weren't educated in them. It's further specialist training to educate in them. But if you have those more specific lipidology breakdown, you can be more specific and more targeted at improving someone's risk. Those essentially are the four main pillars. These are the interconnected systems that connect those different organs that we were talking about. It underpins a solid approach to functional medicine.
And I really love your idea on this interconnected system. And if you gave us a sum up for all the pillars in this, can you walk through with us one more time?
Absolutely. So the main pillars of producing health from a functional medicine perspective is one, looking at your digestive tract, looking at how you digest, absorb, and excrete nutrients. The second is looking at the relationship and the current state of your immune system and the balance versus inflammation or exaggerated immune response. These are all connected, these systems. So you could have your digestive tract driving an inflammatory response, and that's why we call it interconnected system approach. The third pillar we talked about is your thermostats, your hormones, looking at a balance of your hormones, of your stress hormones, your energy hormones, as well as your sex hormones. The final pillar is looking at your metabolics. So looking at how you take sugar, carbs, and make fat, and how you're depositing lipids or cholesterol within your body, as well as key micronutrients, such as the magnesium, zinc, B12, folate, iron, vitamin Ds. When you start to look at the human body in this way, we start to find ways to explain current health states and ways to improve function of the human body.
After you explain in this our interconnected system into these four pillars, it gave us a very clear structure on where to start and how we do the test. Then I do have a little concern about overly treated myself, right? For example, I believe our body can balance back to health after you give them some time to recover and things like that. So will there be a point, like if I test it out, maybe there are the time my body can grow back the nutrients and balance back as an anti-fragile system. But if I gave them, let's say, outside boost, will my body stop producing it on its own? How do you know what amount, and how do you know your body need it?
The perfect example is giving hormones. So we don't use hormones very often, only if we really need to. Because if you're giving end hormones to someone, it will dysregulate their own production of hormones. So if I give you testosterone, you will stop producing testosterone, because the way the hormonal system works is that it works off negative feedbacks. But that's just related to hormones. With regards to micronutrients, that's not the case. So taking supplements is fine. It's not going to stop you from absorbing other nutrients that you need. In terms of the anti-fragile system, it depends how fragile you are. You need to help someone out of that fragility first before they can, and help them build up the resilience. The starting point dictates the ending point. The starting point dictates how far you can go, and the starting point dictates the methodology you would take. So if someone is in a crisis, you need to give them support.
Yeah.
If they're not in a crisis, you can just give them direction.
Yeah.
Right? And the support might be therapies, medication, peptides, supplements, nutrition strategies for someone in a crisis to get them out. To the point when they're out of the crisis, then we just move to maybe nutrition and lifestyle strategies, plus the few supplements that they should take because they're predisposed to needing to take them.
I overheard from one GP. He told me that men actually also have a menopause, but people don't know about it.
The
It's because
andropause, yeah.
their testosterone have dropped down, or their body don't produce as much, and that will affect their mood. Can you tell us a little bit about that?
I think that's partly because we're becoming more sedentary. We're not exposed to as much movement or strength exercises, or needing to move our body as much. I think that's a big part of it, because when we're not using our proximal muscles, we'll find that testosterone drops. And the other side of it is that our environment, through the phytoestrogens that we're exposed to and the xenoestrogens that we're exposed to, these are things that mimic estrogen within the body. Things like microplastics, things like BPAs, even chemicals from sprays and cosmetic ranges, shower gels, etc. So some of these chemicals can dysregulate both men and women's hormonal recycling ability, and can cause something called estrogen dominance. And men can notice that because their estrogen can go up and the testosterone can go down. And women can notice that because they get PMS and early heavy menstrual periods, and then can also contribute to polycystic ovaries as well, a bit more progressed infertility, both in men and women.
Earlier, you have said how important the oxygen is to our health. And I noticed in your clinic, you have hyperbaric chamber and also HT and also unzen IV therapy. I would like you to touch base on all the therapy or treatment on biohacking, or in general on oxygen treatment.
Interestingly, they all work in different ways. So we have hyperbaric pressure oxygen therapy. We have ozone therapy, which is 3 particles of oxygen, O3. We inject that in someone's blood and we mix it with their blood. And then finally, we use cycles of low oxygen therapy, intermittent hypoxic training. They all have different effects to our body. So the hyperbaric oxygen is great because it's the perfect healing environment. It's an environment that stimulates a huge healing response from your body. It's mediated by causing you and your body to release new stem cells from your bone marrow, new growth factors. You create new blood vessels. The organs of your body become healthier. And so for me, it's one of my favorite treatments. And I came across it because I studied stem cells a long time ago, and I came across the fact that hyperbaric medicine causes a surge of your own stem cells to be released. And for me, that was very important. If I could create the environment to make your own stem cells, I was like, okay, that will only help. It's not a bad thing.
Can you overdose on the oxygen?
It's actually a very, very safe treatment. The upper limit of doing hyperbaric is about 180 sessions a year. And then it causes some side effects like short-sightedness, etc. And there are a few others. But no one's doing that much. Obviously, there's nuances on the dose in terms of the concentration or the pressure that you're going to, the reasons why you're doing it, etc. It has to be guided by a medical professional. I do not recommend you going DIYing hyperbaric medicine because you've heard it on a podcast. It's something that you should be led by a medical team to do. But it's very safe. And it can be applied to a whole wide range of the studies across a whole range of health states and disease states, but also ages as well.
When I do some neurostimulation, they subscribe me with 1 hour hyperbaric chamber to accelerate the
response,
new plasticity in my brain.
Neurogenesis, correct, yeah. Did you do it immediately before or after? Probably after.
Yeah, after.
After, yeah. They say not to do it before because it can hyperstimulate before neurofeedback. So we love hyperbaric. I love hyperbaric medicine. The second device I use is I trained in Austria in ozone therapy, intravenous ozone therapy. Now this works very differently. This actually gives you some stress, gives you some oxidative stress. So you get O3, it dissociates into O2 and single O. That oxidative stress that we put in your blood then causes you to produce as a response in the antifragile system or hormetic response. It causes you to produce antioxidants, a huge surge of antioxidants like superoxide dismutase and glutathione. So you upregulate production of these amazing antioxidants that we don't produce as we get older because of efficiency. So helps remove other types of oxidative stress within your body. Oxidative stress is what can cause DNA changes that can be precursors to cancerous tumor growth and cell division. Second thing it does, it supports detoxification. in the liver. So the liver health is very, very important. It's more important now than it's ever been, in my opinion, because our environment's so toxic, because we have so many processed sugars as well. We do the repackaging of fats within the liver. And so having a healthy liver is super, super important. I love intravenous ozone to support that. Thirdly, it's the only treatment that I know so far that stimulates mitochondrial biogenesis. We talked about it right at the beginning. We said even the mitochondria replicate. And now we're understanding a big part of longevity will be focused around, over the next 10 years, understanding how to help healthy mitochondria replicate. Mitophagy, and to help replace the aged mitochondria because they become very inefficient. And so this treatment helps mitochondrial biogenesis, the creation of new mitochondria and reparation of mitochondrial DNA or damaged DNA. And so it also improves the function of mitochondria. So that's why I like ozone therapy. And finally, intermittent hypoxic therapy is my newest treatment. I've had it in the clinic for about 6 to 9 months now. I love it. It's one treatment that increases your Vo2 max. And we know that your Vo2 max decreases 10% approximately a decade from 30 onwards. And what is Vo2 max? Vo2 max is a score that represents our ability to take oxygen and make energy. That score is a number. That number corresponds to how much function you can get out of your body. So a score of, for example, 60 means that you can cycle and swim and you can climb mountains. A score of 20 means that you're not going to be able to cycle and you're not going to be able to climb upstairs very easily. So we know there's a natural decline in our ability to create energy through a Vo2 max. And so if we can do a treatment like IHHT, where a 2-week protocol can give you results where it will increase your Vo2 max by between 5 and 10% in 2 weeks, and the effects last 6 to 9 months, then we can increase someone's function.
Yes.
That's a decade of decline we're reversing in 2 weeks. That means for someone that they're more likely to be swimming and cycling when they're 80.
Yeah.
That means they're more likely, even in the short term, to be able to run upstairs if they wanted to. And that's all about being able to draw in oxygen and deliver it to your cells and utilize and create energy and draw on different energy sources. I love it. It's my new favorite treatment.
So the first hypobaric oxygen is help you to get into good oxygen in you. And the second one, the ozone therapy, is help you to have this O3. So your body have a teeny stress, but it will help it to detoxify the bad stuff. And the third one, HHT, is almost like a mimic when you are climbing on the high and low altitude, so your body can boost back into this system to basically generate more energy in a sense.
Correct, yeah. And the adaptive changes that happen is that your heart becomes stronger. You pump more blood efficiently out of your heart. That's your ejection fraction. And you can expand your lungs more easily when you do that treatment. And your blood vessels become heavier. So your heart, your pump and your plumbing improves.
So this is really good for your lungs and liver. But do you think without any, modern clinical way, if I just do traditional breath work,
Wim Hof methodology, for example,
50 times and then breath hold, do you think that will mimic the similar result?
It's not powerful enough. It's not a controlled enough environment to be able to create those adaptive responses that you need.
Oh.
I'm not saying it's not beneficial for you. It is beneficial for you, but it's not going to get as much reversal. It's not medically powerful enough, and you cannot apply it to disease states as efficiently. IHHT is proven to be effective after heart attack to help rehabilitate heart. Breathwork is not going to be able to do that. Going back to my analogy, the starting point dictates the ending point. Now, if you're doing breathwork from a young age and you're making it part of your lifestyle, you're doing it regularly, of course that's going to be beneficial for you in your plumbing, in your heart, in your lungs as well in the longer run. However, if you decompensated, then you need some support to be able to come out of that decompensation. That's where I see the therapies being a game changer actually for me as a clinician.
You talk about the different treatment. I realize there has 2 types of treatment. One is put your body into a very harmony and beautiful state for it to heal. Another one is actually to give it a little bit stress. For example, like ozone, they are like the type of treatment to give your body a little bit stress.
Absolutely.
So that your body can boost back. Compared with the 2, what type of person need which one, or it doesn't matter which one you give to the people?
Good question. Yeah, I mean, you cannot give someone who's very debilitated too much stress. So first you have to do the healing before you can do the stress.
Oh.
So if someone is very chronic fatigue, debilitated, long COVID, energy dysregulated, down on the floor, cannot sleep, weak, etc., and you put them in a cryo machine, it's only going to make them weaker.
Oh.
If their immune system's already fragile, it's going to actually be worse for them for a period of time. So the adaptive response requires your biology to be in a state where it can respond. I would go healing first, healing and repleting.
Okay.
Right? So repleting means topping back up what your body's missing. This is where NAD comes in.
Mm-hmm.
This is where certain micronutrients intravenously can come in. So hyperbaric and repletion. And then you're right. And the other one is controlled stresses. You always want to replete first. For the best results and for patients that are listening, if they've got a health problem, you want to be guided through it.
Yeah.
Because when you're guided with people that have got experience and know what to do, what's successful, you just get quicker results.
Yeah.
And you will achieve the outcomes you're wanting to achieve.
I think right now IV therapy is something quite popular as well. I have to say my personal feeling on IV since I was little, I'm actually very skeptical and scared about it because in my mind, anything super goes straight to my bloodstreams and go into my body, it's just feel very harsh. And I always believe our body like to be tickled, not hammered.
You will feel okay when you need it. So if at the time when you feel more run down, you'll know, and then you'll need that tickling and you'll be happy to do an IV. So everyone's got a different kind of comfort zone.
Yeah.
I've been doing IVs with patients for more than 10 years. We've probably done more than 20,000 patients with intravenous therapy. We started with simple stuff like vitamin C's and et cetera, et cetera. We're now just about to introduce mistletoe extract therapy. We started at the clinic as well. And ECGC, resveratrol, really more specific targeted micronutrients intravenously. I think it's a very powerful therapy in the right hands for the right patient at the right time. For that period of repletion where you're doing it in a targeted way, it's so much more powerful than just giving supplements.
What does the IV therapy really do for your body?
It repletes you. So it tops up those key micronutrients that you might be missing because of diet, because of state of health, because you're just missing them, or even epigenetics. It gives you what your body requires to do the function that it's missing, that you want it to do better.
But if I do it, will my body rely on it?
No.
Okay. It's like one time top up, and then if I'm good back to normal, I just...
Correct. And that's the difference between micronutrients and giving you a hormone.
Oh.
If I'm giving you a hormone, your body becomes dependent on it, or if you take it away, then it has a negative effect. Whereas with micronutrients, you don't have that problem. It's like supplementing. So when you stop taking a supplement, it doesn't, it just means that you're missing that ingredient.
And what is NAD+?
NAD+ is nicotinamide adenine dinucleotide. It's a vitamin B3 derivative. It's found naturally in all of our cells in the human body. It works in the mitochondria. We've talked about this a lot, the mitochondria, but it's the engine of each cell. And it's part of the process of taking oxygen and making energy within the mitochondria. So to take oxygen, you need NAD to make energy, right? So if you're low on NAD, you're going to be low in taking the oxygen you're breathing and making energy. So it makes it more efficient. The second thing is that it's a precursor to dopamine, one of the calming, motivating neurotransmitters that's really good for motivation and get up and go, and gets depleted with any type of addictive behavior, be it on social media, the dopamine, or substance misuse, etc. And third thing, it activates longevity pathways. So these are families of proteins that do things behind the scenes that you don't notice. Things like sirtuins or PPARPs. These are families of genes that will help with your DNA repair, will help with efficient cell replication. So NAD has been found to be initially extremely important for longevity. It's been shown in populations to decrease naturally over time. It's one of the hallmarks of aging that naturally decreases over time. It's also shown to have accelerated depletion in states of disease, stress, poor sleep. And so when I can give you NAD, the studies have shown that it improves your state of health, memory, focus, attention, motivation, because the dopamine improves, stress goes down, the perception of stress goes down, energy sometimes improves, sleep also improves. You can then apply it to specific health states. It's been shown to be helpful in cognitive decline. It's been shown to improve your production from your ovaries of quality eggs improves. The quality of your eggs improve as well as your sperm quality improves when you're using NAD at certain times. So we use it for patients that have got fertility therapy as well going on. It's been also helpful in skin conditions, in hair growth as well. It's been shown using it in targeted areas. That's all to do with how efficiently your cells are working to make energy, because the more energy they have at a cellular level, their function improves. NAD, I first started introducing it to my patients during COVID that were presenting with profound fatigue, long COVID symptoms that we were getting early on, brain fog, profound fatigue. They couldn't get out of bed if they walked down the road. These are young people that otherwise before COVID were fine. They could walk down the road and they would feel so debilitated. I found that using NAD and hyperbaric oxygen helped replete them enough so that they could start to do a bit more and a bit more and a bit more, and slowly they got their lives back. I prefer the intravenous or subcutaneous NAD because I see more clinical effect from it rather than the oral precursors. I think the oral precursors are good for the longevity effects, which is the behind the scenes stuff that you don't really notice. Yeah. But for the noticeable stuff, I've seen a much more significant effect utilizing intravenous or subcutaneous NAD. We combine the NAD, if you're in clinic, with hyperbaric because it makes sense. They both work on this in the same mechanism, right? So enriching oxygen, enriching NAD, they work together. Things are better.
And you have touched base on hair loss because I know your clinic are doing those treatment. In UK, I do see hair loss is a big problem here. What will be the way to regenerate your hair or to make you have a healthy hair? Or if you start to show signs to losing hair, what will be the way to get the full hair?
You would use a inside-out approach, which is looking at the functions of the systems, making sure that there's no major hormonal imbalance, no major micronutrient deficiencies. So that's number one. Then you would use an outside-in approach, which is how do we target the hair cells to become alive again?
Yeah.
Right? And how do we enrich the hair cells so that they can grow keratin, which is the protein that makes up hair. So you need biotin, you need other cofactors, etc. You need certain amino acids like cysteine and lysine and methionine to make hair. I found the most powerful way to do that, which is exosome therapy. Exosomes are extracellular protein vesicles that are derived from baby stem cells, from stem cells. So it's not the full living cell, but they take out these protein vesicles. Once upon a time, they used to think these protein vesicles or these things that were secreted from the stem cells were waste products. But now they found, over the last 10 years, they found that actually these are signaling molecules. And if we concentrate these signaling molecules and we inject them directly into any area that we're looking to regenerate, we find we get a massive healing response.
Okay.
Prior to this, we used to use PRP, platelet-rich plasma. Studies have shown that exosome therapy is 10 to 100x more powerful than the pre-existing PRP approach. So I love exosome therapy. I'm a big fan of it. I've seen great results with it, with my patients with hair loss and for skin regeneration. With skin, interestingly, it's also, apart from the obvious signs of skin aging, which is thinning of the skin, it's improving rosacea in the skin, reducing inflammation within the skin, reducing pigmentation in the skin, and just making your skin look overall more youthful. We can't wait until we can start to apply exosome therapy in the UK intravenously as well, so that your organs can also stimulate regeneration. There is a little bit of work to be done still in the UK around that. My magic ball in the future, is that a magic ball, a mystic ball? I predict that, that's going to be moving people's health a lot if we start to engage with that, because systemic reduction of inflammation instantly is very hard to do.
And can you tell us a little bit about stem cell therapy?
Stem cell therapy is essentially when you take stem cells from different sources. The starting point of a new cell is called a stem cell. Then it turns into an adult cell, okay, which means an older cell, and then it dies eventually, right? It gets replaced. The stem cells are what are known as more pluripotent, which means that they can differentiate and specialize into different types of cells. We produce stem cells all the time. but the rate of production decreases and the quality of the stem cells as we get older that we produce decreases. We produce them mostly from our bone marrow, and we produce them at night when we're in the deep sleep. It's been shown that if we give stem cells from other sources, can be our own or others, so we can take it from our fat and we can process it and concentrate stem cells, and then we can target it into tissues and joints or skin and hair, and we get a healing response. The world of stem cell medicine is getting better, and I think it's made huge progress. It's used clinically in blood cancers very efficaciously with great results. I think that we will hopefully start to see it more and more, but particularly with exosomes. Because the problem with the stem cells is that when you give a whole cell, it contains the DNA, especially of someone else. So it limits who you can give it to and what you can do. With exosomes, you're not giving any living DNA. You're just giving these protein vesicles, which are these signaling molecules. So I actually prefer the exosomes there than giving stem cells.
Wow, we have covered off a lot of very interesting topic and interesting biohacking technologies. To working in the field for so long, is there anything recently raise your eyebrows?
The trend that longevity has become now, when something becomes trendy, there is a risk of losing the quality.
Yeah.
To do the quality, it requires the studying, it requires going to those and learning and applying that knowledge in a safe, regulated environment. And what we're finding is that with the trend have become people that are not doing that.
Yeah.
They're not applying this with the training, they're not applying it with the experience, and therefore they're not getting the results. Everyone loses in this. All the patients lose, because when things are not done to a good standard, it means that you lose its potential, and it becomes something that is a shiny toy that sits on a shelf, rather than what it could be is the future of healthcare, changing healthcare, making healthcare better. Because if I can learn it as a GP and create a system of care, then every other doctor can learn this and integrate these methodologies alongside their specialty of training, and they can start to see they can expand the results that they're getting with their patients. That is safe, responsible, effective, and it's caring. That's my kind of eyebrows that go up. But I think we also know about the whole social media doctors that arise, the TikTok and the YouTube, and you don't know what information is accurate. Patients have spoken to me and they're stopping their medication, they're starting this supplement because they think it will do the A, B, and C, and they can do risky behaviors. That's some of the kind of things we need to navigate. On the positive side, I really like this new cancer screening test that we have. It's called the TrueCheck cancer test, and it looks for 70 types of solid organ tumors, but the earliest stages of them through what's known as circulating tumor cells. You can find earliest signs of circulating tumor cells of 70 types of cancers, which means that if you're catching things earlier, they're easier to treat. I'm really grateful for that. I'm excited for what leaps and bounds can be made now in cancer. How can we personalize alongside traditional cancer therapy and integrate some of these methodologies to improve quality of health and health span for cancer patients? We've just integrated at Human oncologists, functional medicine oncologists, and consultant oncologists that do both functional medicine in cancer, but then also the other cancer doctor, Dr. Samir, he does repurposed drugs for cancer, where they use certain safer drugs, repurpose them outside of, for example, metformin. They're showing that in certain cancers, increasing the length of survival by utilizing these repurposed drugs. Now, combining that with vitamin C, high dose mistletoe extract therapy, ECGC, etc., curcumin, high dose curcumin. I'm excited to see what that does for patients with cancer.
If you only give one tips for longevity overall, what will be your number one hack?
Be aware of your state. Be aware of how much energy you are expending at any given time, because energy is the currency for longevity. Preserve your energy whenever you can. Don't waste your energy, and be very considerate of your kind of energy reserve, and develop ways to replete yourself when you need to, and to rest and recover when you need to. When you start to do that, you start to prepare in advance. So I know I've got a podcast with Méline Liu and I want to be giving my best, so I'm going to do things the day before. I'm going to monitor what I do the day before in terms of nutrition, movements, etc., etc., because all of these things contribute to our state now is determined by how we've lived, and our state in the future is how we live now.
big energy equals big bank. That's what I believe. I know apart from being such an amazing doctor yourself, I know you are also a very well-established entrepreneur. And can you tell us one entrepreneurial tips that you have to help yourself to stay in the peak of your game?
I think one of the things is know your strengths and know your weaknesses. When it comes to business, try and find your blind spots, and that's hard because they're blind spots, and you only expose your blind spots by making mistakes. But try your best to, once you've made a mistake, to understand your own limitations and build relationships to bring people along on the journey with you that can support you in identifying your blind spots and filling those blind spots. It takes a village to raise a child, and it takes a village to raise a business as well. You need people around you, you need people within your community, within your business, directly or indirectly, that will support you and believe in the ultimate vision and mission that can, just help guide you when you need that guidance.
Thank you, Dr. Yi, for today's episode. I feel I have learned a lot. Looking forward to see you soon again.
Yeah, you must come to the clinic now.
Yeah, definitely.
Thank you, Méline.
Thank you.
Thank you for watching the Humanware Project. To help us to getting more amazing content out there, please subscribe. It means a lot and it will help us to grow. And let's go on this journey together.